All right, good evening, everyone. Welcome to our chat session tonight on YOPD. For those of you who don't know me, my name is Shelley Kurian with Skypass Foundation, and we are going to be chatting all things YOPD, from mental health to career challenges to living well with young onset. I'm joined tonight by a very special lady, Dr. Maria De Leon, who is a movement disorders specialist who has been living herself with YOPD for 15 years. Maria, welcome, and thank you for being here.
Hi, everybody. Thank you so very much, Shelley, for having me. Thank you to Skypass for having this session and for inviting me. And so I hope that everyone enjoys it. Feel free to ask questions. If you think of something, don't be shy. That's what we're here for, to support each other and to learn from one another. So thank you again for being here.
Absolutely. We're excited to hear from you. I've really enjoyed getting to know you a little bit better over the last few weeks, and your story and your journey with PD is so fascinating. And for those of you who are new to Skypass Foundation, we are a nonprofit specializing in serving the PD community. And within the PD community, the three groups that we aim to serve are people with Parkinson's, care partners, and medical professionals that specialize in movement disorders. And interestingly enough, Maria actually fits into all three of those categories. She is a fellowship trained movement disorder specialist, and she's been living with YOPD, as I mentioned, for 15 years. And she was a caregiver for her grandmother who was diagnosed with YOPD. So she brings with her a very unique perspective as a representative of all three of those groups. Maria has also published 3 books. She speaks internationally and serves as a public policy advocate for the Michael J. Fox Foundation, in addition to quite a large body of work that she has done in research and advocacy. So this is going to be a great conversation. Before we dive in, just a few reminders for those of you who are joining us live on Zoom. If you look at the bottom of your screen, you'll see a chat box and a QA box. So feel free to utilize those, either of those or both of those, as much as you want to, as Maria said, throughout the conversation, and ask us your questions. Some of you guys submitted questions with registration, which will be asked of Maria today as a part of our conversation. But in addition to that, if you have any additional questions or comments or insights, we would love to hear those. So please share that with us. So Maria, you were diagnosed at the age of 36. And I'm curious, for those of you who are on here that have YOPD, what age were you diagnosed at? And how old are you now? If you don't mind putting that in the chat box, or perhaps if you care for somebody that has YOPD, what age were they diagnosed at and how old are they now? And we'll be addressing some of that information later on in the webinar. At the age of 36, Maria, what led you to go see a doctor at that point in time? Tell us a little bit about your journey, starting from the beginning, and set the stage for us at where you were in your life at 36 and what led you to receiving that diagnosis.
Wow. Yeah, this is going to take a little bit to discuss.
Loaded question.
Shelley said, I was supposed, someone asked, I was a doctor first. It's funny because my journey began wanting to always be a neuroscientist, but through my studies in college, I discovered one of my professors had a passion for Parkinson's and was really into the deep brain stimulation with the fetal transplantations at that time. And that just fascinated me. And right then and there, I decided that I was going to go to medical school and become a neurosurgeon and deal with Parkinson's patients. However, once I became a medical student, I realized that my passion was being a neurologist and taking care of patients. So I was a Parkinson's specialist in training during my fellowship when my grandmother developed Parkinson's. So I was the one that officially diagnosed her with Parkinson's. And at the time when I was 36, I had a busy practice. I was starting, fairly new, starting in my practice at that time, had a young child, and my grandfather passed away. So my grandmother came to live with us because I was the expert in Parkinson's. So nobody else better than myself to take care of her. She moved from Mexico to the States. And so it began my more personal journey, if you will, of Parkinson's. I had a busy practice over 1,000 patients with Parkinson's here in East Texas. So I had a lot of experience dealing with Parkinson's, but taking care of my grandmother, realized, the flip side of what it is really to be a 24-hour caregiver, to deal with all the ups and downs, to deal with emotional heartaches and the emotional guilt trips when they get demented and confused and knowing what to do, and being there standby, and how you're pulled in all directions. So I began to notice these things in my patients' families. And so they began to recognize also in me that they had a soul, that, kindred soul that they could, talk to about their issues. And lo and behold, unfortunately, my grandmother passed away that year. And I had begun to notice when I was doing my examinations of patients, that I was now having trouble doing the tasks that I usually, as you know, all of you that have been to neurologists and movement disorders, you have to do the finger tap and the open and close and the balance. Well, I was having trouble doing those things. So before you knew it, I was the one looking at myself going like, wait a minute, why am I having trouble doing this? My handwriting started to get really atrocious. Got to the point that my nurse had to do my scripts, had to help me write things because I was having a hard time doing this. And I was the one using the bars in my office because I was losing my balance. I was falling over the place. But the interesting part, and what started really my advocacy journey, is that being a specialist and knowing about Parkinson's, being fellowship training, knowing how to diagnose, still put a stump on my diagnosis because one, I was young, but two, I presented initially with unusual, at that time, unusual symptoms that involved a lot of my vision. I started having trouble driving at night. I could not tell distance. I could not park between two vehicles. And I kept going to the doctor and they were saying, your vision is perfect. You have 20/20. We don't know why you can see yet. I kept running into things. I even hit a drug rep's car trying to park in my spot because I could not tell the difference. So it was really obviously becoming a severe problem, because here I am on call in the middle of the night having to drive and going places and I cannot see yet. For all that we knew, my scans were normal, my vision tests were normal, saw a neuro-ophthalmologist, optometrist, and could not find a reason. On top of that, I also began having a lot of pain that began on the side that my tremors were, and my tremors are very mild. I don't have very much tremors, but my tremors always been mild. And it started on my left side, my symptoms, and I started having a lot of pain. And so again, being a young person and having those two unusual symptoms, also began my search for what is going on. So I, like many people, their young onset, spent about 2-3 years getting an official diagnosis, going from specialist to specialist, trying to find out what was going on. I knew I had Parkinson's and I had all the other symptoms, but the pain and the vision problems was just keeping everybody, what is this, and labeling me and diagnosing me. And even myself, wanting to make sure I didn't have lupus, I didn't have MS, I didn't have, all the other things that we need to rule out, tumors and such. So finally, after a couple of years of going through many specialists, orthopedists, neurosurgeons, surgeons, other neurologists, finally I talked to a friend of mine, a colleague who's a movement disorder specialist, and I said, okay, I need to get to the bottom of this, because by then I was completely exhausted, fatigued, and even my family was now beginning to think, well, perhaps I was still just depressed because my grandmother had died, and I was identifying with all my patients, why would I have Parkinson's? So then I began to question, is there something wrong with me? Am I really just something in my head? Maybe I am depressed, with this vision and this pain. So I spoke to my physician and, went in and had the usual exam, as you all know, and had some other, lumbar punctures, MRIs, and, was admitted to the hospital. And lo and behold, she gave me some Cinemed, which is, we know, the the medicine of choice. And when I took that first dose of Cinnamon, I felt like all of a sudden I was back to normal. My pain went away, my vision went away. So we knew we had the diagnosis, and I knew I had Parkinson's. I was relieved to know that I still knew my neurologist, that I knew that I had Parkinson's, but I was surprised, and so was my physician, to know that this visual problems and this pain difficulties were related to that, and that dissipated with treatment. And so I thought that if I myself, as a specialist, still had trouble getting diagnosed, and had this unusual, that we still had a lot to learn and a long way to go. And I needed to really be more active in trying to bridge that gap. So that's kind of how my story began.
That's interesting with the vision and pain. And I'm curious, you guys that are on here that have YOPD, if that's something that you relate to, if that's something that you've experienced, go ahead and put that in the chat box. I'm curious to see if that's something that is a commonality. Maria, there's a process of acceptance, right, that comes with any kind of life-altering reality. I know for me, I don't have a PD diagnosis, but I've been through experiences and dealt with tragedy. And there's the stages of grief that you go through, right, from denial all the way through acceptance. And we got a lot of questions from our attendees on how to deal with wrapping your mind around this life-altering reality that now my life as I know it is completely different. Everything that I once knew to be true is no longer true. What lies ahead of me is uncertain. Do you feel like you have now gotten to that place of acceptance? And if so, how did you walk yourself through those stages from denial to acceptance?
Yes, and that's a great question, Kelly. We talk about the different stages, but the reality is that not everybody goes through all the stages, and you don't necessarily go in order. There's no rhyme or reason. People grieve differently and go through the stages differently. And even when you do reach acceptance, what I find with time of 15 years of living with the disease is that there's always something, when something new happens, you kind of have to go back and, is this my reevaluate? And what makes it hard is that within a family confine, within, my husband and myself and, my family members and things, that you go through that process at different stages. So you're not always in the same level. And that's what makes it intricate and difficult at times to navigate, because, I may be in complete acceptance and my husband is still in denial. So, that's one of the issues that, that I've had to learn and understand better. But, my first, when I was diagnosed, my first thought was, well, thank God I'm not crazy. I knew there was something wrong, and I still know, my neurology, and I knew I had Parkinson's, and so relief. And then, it kind of sets in a little bit, and you go like, oh my God, I have Parkinson's, and I've treated, thousands of patients, and I know what the disease looks like, and I know, what is my future going to hold. I still remember sitting at a restaurant, all of a sudden, shortly after my diagnosis, and all of a sudden just tearing up, because I was like, oh my God, am I going to be there for my daughter? She's 3 years old. Am I going to be able to take care of her? What's my life going to be like? Am I still going to be able to practice? So, all those emotions coming up. And then there was that period of, because I was an active physician and practicing, and I had a busy practice, was that, am I going to be judged by my patients? Are they going to trust me as a physician if I say that I have Parkinson's? So that issue, when do you talk to, let people know, and so not knowing, do I want to, tell everybody? Do I want to go and tell my patients I have this, tell the boards, are they going to somehow signal me because I have a disease that, they may think that it's going to affect me, my capability as a physician. And so that was a tough time. And I remember, a couple of times sitting there in the parking lot outside my office thinking, now what am I going to do? My whole life, I spent 30 years training to be a physician, doing, my fellowship. This is all I want to do. I just thought of myself, from now until I died, basically, this is what my role was going to be like. My life was going to be a physician. And now suddenly the roles, it came to a halt. But I remember then my husband had some part to do with it, because, he was like, well, just embrace it. And, don't be afraid to go out and go to the physical therapy and the occupational therapy. And so, if patients see you, it's like, embrace it. And, he had a lot of truth in that, because in order to accept something, you have to not just kind of know it mentally, but internalize it and know that this is your new life and this your new state that you're going to be living, and make the best out of it. So, kind of embracing and making it your own. And I remembered, the one thing that's helped me is that, one, because I've been a physician and I've seen all the changes, and from the time that I became a neurologist, from the time I started medical school to the time I was diagnosed, I mean, I've seen huge changes and big strides in the diagnosis and the management, and new medications and new ways of caring for people. So I know that there's hope every time, that I feel that perhaps, I get a little down, that, oh, what's my life going to be like? I think, well, in this 30 years I've been living and doing Parkinson's, in all different stages, I've seen so many advantages and new medications and new treatments that patients don't have the same quality of life they had, 30 years ago. So that gives me hope. So that's one way to make the acceptance easier, to know that there's a future. And also with every step that you have, and here I am 15 years into diagnosis, I have learned to reinvent myself several times. And there's freedom in that. Sometimes, you think that, oh my God, my life is over. I'm not going to be a doctor. I'm not going to be, but the thing is that, it's kind of like life. There's seasons for everything. We age, we change, we have, so it's part of it. So you have to embrace and make it your own, and find the liberation in it, that now you can reinvent yourself, that you can do things differently, to learn things that I never thought I was going to be doing. So that kind of, thinking is what's allowed me to keep going, is what I tell people, that yes, it is hard. Not every day is easy. And some days you just feel like crawling under the bed and staying there under the covers. Today was one of the days earlier. I was not feeling well most of the day, so didn't really get to do much. But you take it one day at a time, and sometimes 1 minute at a time, just to keep going. But that there's light at the end of the tunnel, that we are still ourselves. I am still Maria. Yes, I'm a doctor. Yes, I have PD. Yes, I have all these things, but that's not who I am. That's not who defines me. And that's what I want you guys to know, that you're not defined by this disease, just like we all have, different, diabetes and hypertension and so many things. I mean, we're not defined by that. And so there's tools. You have to make it your own. Find that talent, which is you, who you are, and put that twist in it, so that you can, face the disease and find ways of dealing with it. So that's what I've done. And yes, I have been at times, felt discouraged, because I've had one thing after another happen, and you wear out physically and mentally and emotionally. But being able to accept help, which was my biggest thing, being a physician who's always used to multitasking and being the caregiver of everybody, is very hard to suddenly admit that, hey, you may need a little help, that it's okay to ask for help, that you don't have to do 20 things at once and you're still okay. And so that was hard. And I learned some hard lessons. I fell a few times. I even herniated a disc because I did not want to use a walker or a cane. I thought, I do not want to look like that. But then you injure yourself, and then you learn that, do I want to keep doing that, or do I just say, hey, listen to my body, ask for help, and then, you can live a better life. And so that's kind of the things that I would recommend, not being proud to ask for help, and knowing who to ask for help. So that's, because you can have different friends, somebody you can laugh with, somebody you can cry with, somebody you can tell things with, and it's not always the same person. So availing yourself of those people is incredibly important.
Absolutely. That actually segues perfectly into our next question. We got a lot of questions surrounding the topic of mental health.
Yes.
Speaking of asking for help, and as we all know, mental health is a beast in and of itself. There's so much to explore there, and so many needs in that area that are not being met. One of our attendees wanted to know, have you seen a mental health professional at any point over the last 15 years, specifically to deal with your YOPD diagnosis? And if so, what was that experience like for you?
No, I have never seen, that's the one specialist I think I have never seen, although it has been suggested many times by my colleagues before my diagnosis was that perhaps it was all in my head and I should go see a professional. Um, and and there's a role for psychologists, psychiatrists, and counselors. And so I've never seen one, although I have had one episode that was very, very severe, that I was almost suicidal. Well, I was on the verge of suicide. And that was very eye-opening to know how quickly that can come on. And for me, it was due to my medication that triggered that episode. I am a very spiritual person. I have a strong faith, and I think that that's part what keeps me going. And I think having a belief in something beyond yourself really gives you hope and lets you continue. And because of that, I think that I averted something that perhaps some other people may not have, because I was literally, it was unlike me, uncanny, because I am the most optimistic person, in the world. People always tell me that I see the world with rose-colored eyes. And so for me to think that, I just want to end it, and I was just crying in tears. But having my husband, who is a very wonderful support and anchor, and noticing that, hey, this is not you. What is going on? What has triggered this? And still having in my mind that, still kind of that physician, why have I changed? What has happened? Not controlling the emotions. I mean, still just, a nervous wreck. I used to say that I look like the Llorona, just crying around, weeping everywhere for everything and just wanting to just kind of die. But again, thinking that why, God is strong, I would never do that. But still fighting that urge and thinking, what's caused this? And then I thought, what has happened recently in my life? And I thought, this all started when I started this new medication. So, and my husband to realize like, okay, this is very abrupt. What is going on? What's happened? And I said, I started this medicine, and we discontinued it, and thank God all the symptoms, went away. So it's something that, particularly in different communities and minorities, it is very important to be aware of this, because we know that Parkinson's, especially in young onset Parkinson's, can begin with a lot of mental issues. And actually in me, it did too. When besides my vision and my pain, I was extremely irritable. And I just cannot, for the life of me, patients love coming to see me. They love coming to, to talk and hug me, hug them and stuff. But I got so irritable that I just could not stand people. And my staff of 10 years, of course, they known me, they knew who I was, and they're like, what is going on? Why are you so cranky? And of course I was in pain. So we all assume, it was a pain related, but no, it's the lack of dopamine that makes you just irritable and makes you not think right. And I think that that's part of one of the things, that to recognize that you have something going on and to seek help, whether it's a mental health professional, whether it's your primary care doctor or your neurologist. But I also have discovered that a lot, or 99% of the things that we discuss as mental issues can be reversed, can be treated by treating the actual Parkinson's with dopamine medications, with dopamine agonists. And so in the past, when I have gotten some anxiety or some depression, is usually related to the fact, except that episode where I got suicidal, that is usually related to not having enough dopamine. And so adjusting the doses really has helped. And so that's one of the things I always tell people, we all talk about this apathy, and apathy for neurologists and is more of a not caring. But I think for Parkinson's, what we talk about apathy is more of a, we don't have the drive to do it. We want to do it. We know we have to do it, but we just don't have the oomph to do it, like you're lacking the fuel. And that's very different than not caring, not caring or caring about your environment, or if you look good or don't look good, if you shower or don't shower. That's very different. That's what is true apathy versus just knowing you have to do it and you should do it, but just can't get to do it. That's very different. And those things can be treated most of the time, like I said, by adjusting your Parkinson's medication. And so it's important to talk to the doctor and keep a note of that. And it's something that not just once in a while you feel bad or you feel, like you don't want to, you feel a little sad. It's normal to feel like that. But if it's a consistent thing, then you need to address it. And sometimes we do need some counseling because, there's issues of dealing with, one, accepting it ourselves, what we're going through, having the tools to deal with what has been thrown at us, and also having the tools to deal with all the people in our surrounding. How do you now navigate all these relationships and all this work, when you're having that? And so sometimes we do need that professional help to be able to say, hey, what do I do when I feel like, I can no longer work, when I can no longer take care of my family, when I'm just so stressed, I'm so overwhelmed that I'm paralyzed. I don't want you to feel paralyzed. Yes, it's okay to be a little afraid. It's okay to have some uncertainty, but to not move forward because you're so afraid, then that's something that requires some attention. And what has helped me, I taught, one, because I said I have a strong faith. I attend a lot of women's Bible studies, so that having that spiritual, helps me, deal through the mental anguishes, through the uncertainties. But also I teach other women. And so teaching boundaries has helped me, to learn to put boundaries on me and my disease, what is important, prioritize, because sometimes we don't really know how to prioritize. We want to have everything, do everything, and we keep being stuck on, we used to be healthy, now we're not, and we keep being stuck in the past. And so we keep holding on to that balloon, Parkinson's balloon, and it keeps getting in the way, and it's just all over us. We sometimes have to let it go. So get out. And so we can open up our hands and free our hands so that others can help us, others can hold our hands, others can support us, and we can give to others and embrace the disease. And so we sometimes need that. What do I need at this point? That's why I always tell, like, make priorities for, a month, 3 months, 6 months, a year. What do I am in dire need of right now? Do I need to spend time with my family? Do I need to spend time on my health? Do I need to spend time on my work or my relationship? And then, what do I want? And so keeping those and evaluating them, I think that that's how I have managed to deal with all the mental, sometimes you're not feeling well or not, the uncertainties. And I think that that's really helpful for most people, knowing that it's okay to say no, that it's okay to take time for yourself, that it's okay to ask for help, that you're not weak, that you're not somehow, a lesser person because you can't handle all these things. Nobody can. Nobody can have everything at the time, even if a normal person. You can have everything you need and everything you want within the confines of what you can do. And that's where the key is, figuring out what it is that I need for me to be able to thrive with this disease and be able to take care of the people that are depending on me and my family and still have a life outside of Parkinson's.
Absolutely. Guys, I'm interested to hear from you guys and what your experience with mental health has been. At Skypass, we are working on some initiatives specifically for YOPD, which I'll get into a little bit later in tonight's session. But I'm just curious to know if you're comfortable sharing, and there's an option, by the way, with the chat to either send it to just myself and Maria or to send it to everyone so that it's visible to everyone. We've gotten some private messages here as well. So thank you to everyone that's contributing to the chat. But let us know if you're comfortable sharing what your experience with mental health has been in terms of the ease of accessibility to a mental health professional that you feel like can understand you, whether or not this is something that you've been struggling with. Perhaps someone has suggested that you see a professional and you just haven't been wanting to take that step. Whatever your experience has been with mental health in relation to seeing a professional, I'd be curious just to hear from you guys on what that's been like for you. So if you're comfortable, go ahead and put that in the chat box. In the meantime, Maria, Peter
Yes.
here says, I think PD, going back to how you were saying, PD does not, your disease, your diagnosis does not define you. Peter had a comment here that I'm just curious to hear what your response to this is. He says, I think PD does define you as the disease progresses. There are so many things that we can't do, but must to just live. What would your response to that be?
Well, I see what you're saying. Yes, there's been so many changes, and yes, it is so frustrating when you can't tie your shoes anymore, when you can't put on your clothes, when you can't button things, when you can't multitask like you used to, and like me, now that I have trouble typing and writing and speak at the same time, it's like, okay, like chew and walk and chew gum, at the same time. So it is something to note. And so in that regards, yes, I guess you can say it defines you. But what I'm trying to say is that I don't want it to be what limits you, is that whether you're the person half, glass half full or half empty, do you want to focus on the negatives, on the things that now you can't do, or do you want to focus on the things that you can do? And you can do things, but you have to learn how to redo them in a different way. And that's where the capper is. You used to be able to take it for granted where you can just put on your shoes and no problem. But now you have to sit down, you have to have, a shoe helper, you have to do that. So it can be done, but it has to be done differently, kind of making you pathways. I always say, like, when you walk on a fresh fresh field and there's no tracks, and then you start walking and then you keep going, and pretty soon there's a path, so there's no reason to venture anywhere else, right? But then suddenly that path gets destroyed, or there's some flood there's some water, there's something, and you got to go around now and so it's going to be a little hard at the beginning, right? The grass is tall, there may be some leaves, there may be some things unexpected, but eventually you will get through and you'll build a new path. And that's what we're trying to do, that build those new connections, find new ways of doing things. And I think that's some of the liberating things, because sometimes we get so used to doing things automatically, we don't think about it. We take it for granted. But when you have to rethink how to, now you have to bathe differently. Now you have to use an electric toothbrush because you can't brush your teeth the same. Now you have to, for women, find different kinds of jewelry. Can't wear, high heels that have straps on the side. It is annoying. And yes, you wish you didn't have to do that. And, yes, we struggle. And God knows, some days I'm just like, why can I just put on my shoes? No, why can't I wear my boots? But I think you do yourself a disservice if you focus too much on the what I cannot do, instead of the let me figure out how I can do it. And that we have so many new medications that I think that sometimes we do get tired. And I know 15 years, and I've been a doctor for a long time, I don't like going to the doctor either, because you always feel like, oh my God, I'm going to try something new. There's something going on. But sometimes this is the nature of the disease, unfortunately, until we find a cure. Every time something changes, we have to go through the same steps, which medicine, how we're going to change things. But I think that if you're able to put in that work, that I think that in the long run, a life will be a little bit better. Yes, it's not going to be entirely, oh, I'm going to be back to when I was 20 and doing everything I wanted to do. But then this life is kind of like, we age. Now I'm 50. And so sometimes I think like, am I just more, is it more pain because I'm 50 versus because I'm, actually of course my disease has progressed. But sometimes, you don't know like how much is your age. I was able to do so much more when I was younger. You have more energy, you have things, you don't have your body, changing too. So I always like to think of it the positive, way of dealing with that. Yes, we have to live with this disease. Yes, it infringes upon you. Yes, it limits what you do. But I don't want it to be the sole reason you focus your life around, that you're focusing just on the list, but rather find, okay, now I can't, my family knows that when we go out or nowadays, I can't stand more than 2 hours, without taking a break. So now it's like, we know we plan things. Okay, we have to take a break until I go sit down, go eat, go watch something, take my medicines, make sure you rest. Yes, it's a pain. Nobody wants to do that. But, it still allows me to be able to enjoy life and be part of my family and do things together. And it is a commitment from everybody, and they know what they're going to. So we don't plan a lot of things that we know that's going to put an extra, a stress without planning on how we're going to deal with those stressors. I hope it helps.
Yes, absolutely. So much great engagement here in the chat. I almost can't keep up with all the messages coming in, but thank you guys so much for sharing. Just so interesting to see people's experiences. I'm going to read just a brief comment from one of our attendees that he struggled with mental health challenges and multiple suicide attempts,
Oh,
but had reached out to his local Parkinson's organization for help, in addition to discontinuing medications that had negative effects on his mind. That's really interesting because I think a lot of folks that I've talked to are not aware of how their medications are having negative side effects on them mentally. So that's definitely something to talk to your MDS about.
Yes. And having a support, and there's a self PD group that is only for newly diagnosed, but I know they were talking about it for older Parkinson's, but it's a course where they give you these tools to be able to when the negative thoughts come, when the negative ideas or the depression, you can pause it, stop it, and think something else. So they teach you how to do that. And I think that's important, whether it be with a support group, whether it's this PD self, whether it's with a, church organization or counselor. You need to have that support to be able to have control. It's important to listen to your emotions, listen to your body, and listen when you're down and sad and depressed and anxious, to be able to talk and get help. But also, we don't want to be ruled by those emotions. We don't want to live in constant anxiety and fear and depression, because there's different ways to deal with it, whether it's with social groups, sometimes exercising, sometimes talking to a friend, sometimes painting, singing, dancing. Find your passion. That's why I would say, find that passion. And that is the reason for living and getting up and beating this, because when you find that, it's going to automatically release endogenous neurochemicals, your dopamine, your serotonin, all this feel good, so that you can just have that already. And and it's funny, I'm sure you've heard this, and it happens to me all the time, and it used to happen to me when I was seeing patients. They would always tell me, why is it that my husband or my wife, when we're out, they're lively, they're engaging, they're moving, and then they're home and they're just like a lump in a log, and my husband would tell me the same thing. How come when you're home you sometimes kind of crash and not do it, and then you go out, have these talks, and I'm lively, and forget that and it's because of those endogenous chemicals. You find something, and we call it the Kamehameha effect. My husband and I have quoted the Kamehameha effect, that when you find that passion, that's something that is a good positive reward system that makes you happy, is going to release that. So whether it's exercise, whether it's whatever it is, that put that in your routine.
Absolutely. Real quick, before we need to move it along here because we're already 7:40, but real quick, Jennifer asks, can you just reiterate again what PD Self is, because she missed that.
It's a group from Diane Cook, and got a brand from I think the NIH. They have a group. Just go PD Self, and it's from Arizona, and not Arizona. Yeah, Arizona. I'm sorry. But they teach us a course of a month or 6 weeks, and they teach you how to be able to learn these tools. So, but it's in the past, it's only been for early diagnosis, not young onset, but early diagnosis. So I don't know if they moved on, but it's worth to look at it.
Okay, and I just Googled it and I put the link in the chat.
Yeah.
For anyone that's interested in looking at
And
that.
you can even be a mentor for it. You can train to be, to have a program in your area so that you can actually be, a person that teaches this course. So if somebody's interested in that.
Wonderful. So moving along, there are some in our group, Maria, that are currently living alone with YOPD. Any advice or tips for anyone that is watching that does not have a care partner living with them?
God, I know my heart goes out to you, and I just recently kind of got a feel for that a little bit more on a personal level. And what I've really come to the conclusion is that even though you may not have family, I think there's something to be said about developing friendships, multi-generational. Because I think that I have found myself in this condition where, I am taking care of my father-in-law, my husband, and dealing with my own issues. And so, you become, and there's nobody else around. So what do you do? And so you need to have people, because all my friends, they're older than my age, well, a lot of my friends, and they're all going through their own issues with the same medical problem stuff. So they're not, even though they're very good friends, they're not really available to give a helping hand. They can talk, but they're not there to really, provide help, like take you to the doctor, give medicines. So sometimes what helps, if you have younger friends, then they're not in that stage. They're much more, one, have energy, and two, they're much more willing to do that. So avail yourself of a group of people, whether it's through a support group, whether, through the church, through a counselor. Try to find at least one or two people that you can mesh with, that you can relate, that somebody that you can call when you need assistance, physical assistance or mental assistance. And I think that, for the Hispanic communities, I begin to think this a lot. Maybe that's why it works so well, because, families are so close knit that you usually have multiple generations all living, so you can lend a hand, if one person can't do the other person. So, and then if that doesn't work, there's with the insurances, there is home health, there is people that can come clean your house, there are people that can provide meals, there are people that can help through the nursing schools or school of social work. Get in touch with a social worker that can help you figure out how to get the aid that you need, so that you're not alone, so that you're not suffering and wondering, what am I going to do? I can't do this, I can't do that. And so those are resources that you can use through your doctors or social workers, through the church, your insurance. Usually for most insurances, if people have a chronic illness, I know they call me all the time. Do we need to send a nurse to your house? Do we need to send somebody to help you clean? Do we need? So you can call them and find out what it is available to you, so that you're not struggling alone.
Great advice, Maria. Thank you for sharing. And if anyone on here is living alone with YOPD and has any tips or suggestions that you'd like to share in the chat, please go ahead and put that in there.
Get those mothers, those when my daughter was little, I really relied on a couple of friends to help me, pick up my daughter from school, take her to school, do the after school activities, because sometimes you just can't feel like you can do it. And if you have the chance, then, rest during the day, go drop them off and then try to rest, and then, be available to pick them up. But sometimes that's, you have to work, you have other commitments. So, get some of those people to help you. and have a list of what you need help with. So it's a lot better if you know what help you need so they can help you.
Absolutely. You know, at the beginning of this webinar, we had asked you guys to tell us your age of diagnosis and where you're at now. And I think, you know, looking through those answers, I think it perfectly reflected the reality that even within YOPD, right, there's still a range of ages and life stages. And the person that has YOPD that's 35 and parenting small children, you know, has a unique set of challenges that perhaps the person that's 55 that has YOPD doesn't have, that maybe was diagnosed in their 40s. So this brings me to a great question. Maria, you and I had talked about this in a separate conversation, but one of our attendees had asked, do you think that the age of a person diagnosed as YOPD should be lowered with a graduation date as well for the sake of support? So in other words, relatability being an issue, right? With 30 something and the 50 something. So when it comes to support groups, chat sessions, and just general groups to plug into, should there be a change with the age of diagnosis as well as a quote unquote graduation date?
That's a great question, Shelley. And you and I had talked about this. You know, there's still, depending on where you are, whether you're in the States or you're, you know, you're an MDS or you're a neurologist, or probably, you know, there's a range of when young onset PD is, anywhere from younger than 40 to up to like 50. So, you know, that age. And we've talked about this. That I think that we've not really done that in the past. We always think about young onset PD and the people that are there, you know, usually in their 30s or 40s, but then somebody like me and some other you in the group that, you know, were diagnosed when you were young, but you're now a little bit older, you know, it's where you feel comfortable, you know, because I really think that, you know, I now in my stage in life, I don't have a lot in common with the younger PD because I've already passed that stage of raising a daughter, of being, you know, working, of being, you know, having hormonal issues and things like that. So now my stage is different. So to me, perhaps, you know, the different groups should be, you know, the young onset, you know, what stage you are, you know, are you a newlywed, you know, are you just starting a family, or you're a retiree? You know, the needs are completely different. Are you single or are you widowed? You know, so I think that that's more, to me, more of a value than what your age is at the time or the age of diagnosis, because you may not, you know, you may have gone through some things and you need specific support in some issues, you know, that perhaps somebody else that who may be your same age, but is not going through that. So may not be relatable. So I think, you know, having the two, now I feel more comfortable just in a general Parkinson's group because, you know, I am older. And so, you know, I don't really need to talk about the young onset, you know, what I was going through 15 years ago. So again, finding that group is up to you, where you feel comfortable, where your needs are. You know, are you still working? Are you retired? Are you having to, you know, are you single? Do you have a husband, a wife, you know, those kind of things. Financial issues, you know, financial stability is a big thing, especially when you live with a chronic illness. And so, you know, finding that right support, I think that, you know, something that is worth looking at to may perhaps need to do separate groups, you know, depending on where you are at stage in life.
You know, as a follow-up to that, John asks, do you think people should graduate from being YOPD much like being called newly diagnosed? And Maria, this is in the QA box if you want to read it yourself. Read along. I'm reading it out loud.
Well, I think, you know, it really depends on the person. You know, I hate to say, yes, you can't be in this group anymore. You're past the age, you know, you got to be kicked out. It's kind of like we have a club here, the newcomers club to the town. And, you know, there are people there that have been here for 30 years. So they're not really newcomers, but they like the people. So it's kind of where you find your niche. You know, if you're comfortable, then there's no, you know, why should we say, no, you can't be here? But at the same time, sometimes I think that it is good to grow and change and look, you know, again, depending on your perspective, you know, what your needs are. But if your needs are being met where you are, then there's really no reason to change or to say, well, you know, you've already been diagnosed for, like me, 15 years. So you can't be newly diagnosed group, or you can't be you know, you're no longer 30. You know, if I'm able to contribute, I'm getting something from that, then, you know, I think that it's the individual decision, you know, where your value and where you get, you know, support.
You know, it's interesting. This is something that I've talked to many different community leaders about, and I think from an organizational standpoint, this is certainly something to keep in mind when developing programming and ideas to cater to the different groups of people, right? So making sure that YOPD, it's not one size fits all. Within YOPD, there is a breakdown that exists within there, and that's something to be cognizant of as a community leader from that standpoint, as we're trying to come up with solutions to serve the community. Also, Lisa said, if you age out, perhaps you can offer someone else advice because you've been there. And I think that's great, speaking to your multi-generational piece of advice. And I think in general, I know, in business, we talk about how you want to have someone to mentor that is younger than you. So you've already walked their path. You want to have someone that's on your same level so that they can relate to you. And you also want to have somebody that's gone ahead of you so that they can mentor you. And I think the same principle can apply really with anything.
Yeah. Well, I
And
think that's why I was talking about multi-generational. I have,
yeah,
my husband teases me because I have friends that are literally my daughter's age, 20 years old, and I have friends that are, 80 years old. But
yeah,
is that, because there's always something that you can learn from somebody else, whether they've been through it or you're going through it, somebody you can relate to, find that person that, you can say, hey, I'm going through this. And they say, yes, I know what you're going through. And then also be a mentor, because I think that mentoring really helps the person living with the disease also, one, grow, and also not focus on their own disease. And it helps the other person that is struggling, kind of like the AAA programs. You have a mentor, you have a sponsor, having one person, you don't have to have a lot, but one person that's going to be, that you're going to be responsible for, and they're going to be responsible for you. So they can check on you, you can check on them, say, hey, how are you doing? Keep them accountable. And so, in that regards, if you want to have that, then, aging out or having an age and then moving on graduate, it makes no sense, because then you're able to help each other out with the different, yeah.
speaking of ages and life stages, a lot of our folks are parenting young kids, or they're newlyweds, or they're in long-term relationships, even without children. I want to kind of lump a couple of questions into one for the sake of time, so that even if you're not married, or even if you don't have young children, perhaps you're in a relationship and this question can apply to you. So this attendee asked, I have young children and I'm running low on energy. Any tips or advice to be a better parent for young ones with PDs? That's the first part of the question. The second part of our question was how to handle marriage as a newlywed, or I want to say also, a long-term partnership. So that way everyone gets
Yeah.
welcome benefit.
God, these are loaded questions that we can talk
I
for
know.
hours.
I know.
Maybe my Parkinson's diva may help with that. I have a lot of talks in marriage and those things. But I think in general, the two things that I would talk about, yes, I mean, having children is tiring, and they're running all over the place. And I've been there, done that, and I know exactly what you're going through. And I think the key is, at least for what I've discovered and learned, is consistency. Your kids are still kids. They still need an adult that's going to be there for them. They don't want to be the caregiver. They don't want to be wondering, is mom or dad going to still be there? Are they going to be okay? Am I going to be okay if something happens to them? So, discussing with your kids what's going on with you, it really depends on their mental age, how wise they are, how savvy they are, how they understand things, and to not overwhelm them, but being consistent. And that's the one thing that I try to do with my daughter, with my children, is that always be the parent. Even if I felt like I was dying, even if I had no energy, always set rules and boundaries and be the parent that they know they can trust somebody that's always going to be there. And I think that makes the difference. The same thing with marriage. God knows marriage is hard enough, without having to throw all this in the mix, especially if you're newlywed. And I know so many people get divorced, and so many people, don't want to deal with the challenges. I'm very grateful that, my husband is a good support. It's not always easy, because again, one, we have to remember that we're individuals and we deal with things differently. We look at things differently, and men look at things differently than women. Men usually want to find a solution to the problems, while women are all over the place trying to figure out. So you have to learn that person. And if you're newlywed, you're still navigating that marriage, and now you have a disease with it. But in a way, it may be better, because, we were sort of newlyweds when everything started. I mean, not quite newlyweds, but you learn to see and grow together what the weaknesses and what the strengths of each other are, and rely on each other. The thing is communication, 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 and
Yeah.
respect, and know that you're not always going to agree. And like I said, I may be in total denial and my husband's already moved on to acceptance, or vice versa. So something that we have to talk about and say, okay, what happened? And I think that that's, there's no easy solution, but other than putting the work, you have to put in the work. It's not all about the patient, and it's not all about the caregiver. There's got to be, and it's not all about the disease. And the one thing that I've learned, I think is very important, especially with this chronic illness, is that sometimes at the beginning, when we get diagnosed, the caregivers, or even us as patients, we want all the attention and we're like 100% committed. But what happens? This is a marathon. This is not a sprint. This is a 30-year, 40-year life commitment. So you don't want him wearing out. You don't want him to be, doing everything for you. If you're able to do everything on your own, having your own goals, your own dreams, and then combine goals and dreams, still be an individual. So my husband, for all these years until very recently, I go to the doctors myself. I take care of myself. I have my own, if I need help, then he jumps in. But otherwise, he's my care partner, not my caregiver. And so I think that that's something that needs to be addressed at the beginning, because, I've seen it so many times. People are all in trying to be with them all the time, trying to cater for them. And what happens, the caregiver gives out, gets burned out, leaves, or the patient then becomes really where they need the help, and now there's no more energy. So I think that those are the things to keep in mind.
Absolutely. I just want to pause there quickly and address a couple of things before we move along. Number one, it's 7:57. I just want to give you guys a heads up that we are going to go a little bit past 8 o'clock because there are some important questions coming up about career that a lot of you had. So we are going to go a little bit past 8. If you have to jump off, feel free to jump off. This is being recorded. I'm more than happy to send you a link to it if you're not able to stay for the whole time. Secondly, there was a question here about support groups. That Amanda asked, Dallas versus Fort Worth, and John had said he had some information. He wasn't sure if it's outdated. And Faye had said to reach out to DAPS. Amanda, I'm actually in the process of putting together a list of support groups locally, because there's some work that we want to do here with the support groups. And so I'm in the process of finding out the most up-to-date information, at least as far as Dallas Fort Worth is concerned. So I will have an answer on a very specific answer for you within the next couple of days, and I will send that over to you. And going back to mental health, I know that a lot of times when we're talking about these things, it seems like we talk about it and then nothing gets done with it. I just want to quickly say that we are working on some programming to get to enable access for people with PD to mental health, to professionals that are familiar with PD specifically. So the reason we're having these conversations isn't just to talk about it and for the conversation to die tonight. We are very much using all of this information and the feedback that we're getting from you guys to try to see if we can actually solve some of these problems. So I just want to give you guys a heads up.
And I just want to say one thing, that I think that, we as physicians and sometimes as patients, we undervalue the role of a social worker, because a social worker not only can help us navigate those mental issues, but it can also help us navigate those social issues with a husband, with the children raising, with finances. And so I think it's important. That's something you can bring to your physician, referral to a social worker, so they can help you get the resources and the programs that you need, so that you're able to be better prepared to deal with those things.
Absolutely. Thank you. Thank you for saying that. That's very important. One quick question before we move on to career that was submitted with registration. Are there significant differences in the progression rate of PD between YOPD and idiopathic PD? Or is there an increased risk of developing dementia? And again, if any of you guys have any experience with this that you want to share, feel free to put that in the chat. But Maria, I'll pose that question to you.
Yeah, well, young onset PD is idiopathic PD. It's just a different, age. And we right now still, don't know much what causes Parkinson's, and that's why we call it idiopathic, because we don't know. We suspect that about 10 to 15% is genetic. Some recent studies of the PD generation has said that perhaps it's a little bit higher, up to 30%. However, that may be a little skewed because we're doing patients that already have PD. So, so that may be a little skewed. However, most of it is not really known. And we know it's a slowly progressive disease. However, Parkinson's is more like an umbrella, a syndrome. We're learning more about Parkinson's every day, and it's not one single disease. And that's perhaps the reason why we see so much variability, why we see so many people have different symptoms and present differently, because I think there are subtypes. We have those that are genetically caused, those that are familial, those that are autosomal dominant, those that are recessive. We have perhaps ones that are autoimmune disease, like the LRRK2 gene, or there may be some other things that we don't really know yet. We know that people that have migraines with auras have higher risk. So there's different causes of Parkinson's. It's kind of like having cancer or breast cancer. Breast cancer is not all the same. You have breast cancer, but you have type 1, type 2, different receptors. So it's the same thing about PD. And unfortunately, right now, we don't have enough information to treat it differently. But I think that the more we do this genetic studies and we gather more information, the more specialized, individualized medical treatment we're going to be able to have, so that we can see specifically what type of PD you have, so that we can try to halt it. The progression, as I said, it's always been thought slow progressive, 20, 30, 40 years. Of course, if you're younger, you may have, you may present, have cognitive problems at a younger age because you've had the disease longer. Because usually we suspect that Parkinson's dementia occurs about 40 to 50% of the people, and it usually starts after, after 10, 15 years. However, personally, this is my own view, I think that the more we understand about Parkinson's and the more we understand about how the disease progresses and cognition, I think that that can be prevented in some ways. I think that starting early treatment, early diagnosis, and making sure that we are, sleeping well, which is one of the risk factors, that we're eating well, that we're, doing exercising, being cognitively and mentally and physically active, that decreases. So, I think that we're going to see some decline. Yes, some people, with the DBS, there may be some changes. So it doesn't, just because you have Parkinson's or just because you have young onset, doesn't mean that you will have dementia. And I think now with the medicine, I think there's going to be, we're going to start seeing, again, that's my personal opinion, start seeing decrease in the numbers, but we have to be proactive. And there's also, we know that we have Parkinson's, they're more tremor dominant, and we have Parkinson's, they're less tremor dominant, like myself. And people that have more tremor tend to have less dementia risk versus people that have, akinetic. So again, goes back to, the type and what you are in stages. We're hoping that at some future date, they've been doing a lot of studies on this DAT scans, then we may be able to predict who will have dementia, who will not have dementia. They're still working on that. So, there's been some findings that say when you get at a certain age and you see those findings, they're more likely to have dementia, but they're not at the stage where they can say across the board or predict it. So we're getting more information as time goes by. My recommendations are, again, physical activity, mental activity, eating well, sleeping well. I think that's one of the huge problems with the dementia risk, is that us with Parkinson's and many other chronic illnesses, we do not sleep. And our doctors, because we don't really prioritize it. Sometimes we don't really make enough noise to say, hey, I need to sleep. And that sleep is that restoration. That's when you get rid of all that junk, that trash. And that's when you build new neurons and new connections. So we need to sleep. And for me personally, sleep is my priority. I still can't sleep through the night, but I make sure that I sleep at least 6-7 hours, even if it's in the morning. So I have rearranged my schedule with my family that I have to sleep. And ever since I started doing that, my quality of life and my cognitive skills have, been stable and have, improved. And I think that's because we just don't sleep well. We don't prioritize that. And so I think there's some things we can do to prevent. I think that we're finding that with Alzheimer's patients, that there are risk factors and we can control some of the things.
Switching gears here quickly before we close to career, we got some questions regarding career challenges. A lot of the folks in our group are working full-time.
Yeah.
One of the questions was, how do you manage, and there's about two or three questions here, so we'll just try to go through these as quickly as we can. How do you manage side effects of medications while at work?
Yeah, that's a good one because, God knows I have every side effect to every medication, and even as a doctor, just because I knew what medicines to take and how they worked on my patients did not mean that I tolerated the same way.
Yeah.
So it is a process, and it is a process to be willing to try different medicines and work with it. I wish there was an easy answer because everybody's so different. The one thing that I can tell you is that us women in general are more sensitive to the side effects, are more sensitive to the medications. And I think my rule as a doctor and my rule as a patient is always starting slow and low, going the lowest dose you can and going the slowest you can to make sure that you build up tolerance, that you know how you're going to react. So it may take a little longer to get there, but then you're not going to have all those side effects by starting at a big dose or, a normal dose that perhaps men can tolerate better than women, or if you know that you're a sensitive person, start slower and start medications at nighttime when you're going to sleep so that you know that you're not going to be affecting work, or when your days off, or when you're off work. So kind of to get a feel of what the side effects are going to be like, what you're going to be like with the medication. And that's always been my, when I have my patients, always very slow, very low, not rushing, one medicine at a time. Ask your physician, what is this medicine for? Am I going to take it with other medicines, or is this going to substitute something else? How fast will I learn whether it's working or not? How long can I, go on before I see you? Can I see you sooner, if I don't tolerate it or if it's not working? So this way you're not sitting there battling all these problems, being asleep at the wheel or being, passing out because your blood pressure is going down or, really nauseated. So finding, the solutions, talking to other people too, how does this medicine work? But listen to your physician. And again, slow and low, and take it when you know that you're not going to be engaged in an activity like driving, or, you have to do some procedure or have to be, make decisions so that you know how you are going to tell it, and add one medicine at a time, not make several changes at a time. I think that's what I would recommend. So this way, too, if you have a side effect, that that one particular medicine did it. However, going back to, my scenario of the getting suicidal, unless you had an allergic reaction, and again, it's up to you and your doctor, unless you had an allergic reaction, life-threatening, sometimes it is not so much the one particular medicine, but it's the combination of medicines that make you feel that. And as we age, our body changes. And a lot of times as a physician, even now myself, as I've gone older, I've been on this medicine for 10 years. It's like, why am I not tolerating it now? Because our systems change, our bodies change. And so it is important to not give up on a medicine just because you didn't tolerate it one time. Again, unless it was something, drastic, that it was really, an allergic reaction. Most times I find that is the combination that causes the side effects more than the actual medication, unless it's the only medicine you're taking, then But if you're taking 2 or 3 medicines, that's usually the case. And if you're taking blood pressure medicines, don't take it at the same time with your blood pressure medicines, because then that's going to bottom you out more and potentiate the side effects usually. And the same thing with some of the, medications for depression. If you take it sometimes they may make you more sleepy. So there's ways to get around things. So you may have to stagger medicines. But remember that now we have so many choices so that you can have oral medicines, patches, sublingual, so you don't have to take such a burden and so many medicines so many frequent times a day, so that it's interfering with your day, because that's not quality of life either. So trying to minimize the number of medicines and different routes and different modalities. There's long acting, short acting, so that you're targeting your whole system. Our brain is in perfect balance. And so we want to try to maintain that balance as much as possible. So taking my advice as a Parkinson's doctor is always taking small doses of several different medicines and low doses, and trying to keep that balance. And that's what I've done as a patient myself. And, 15 years out into it. So everybody's different, but I think in my patients, I think that was my strategy, and most people did very well with that kind of strategy.
Interesting. I like that you mentioned the combination of medications too.
Yeah.
That can be the cause of some of those negative side effects. So
yeah, sometimes, patients will come and say, I'm really, really nauseous, I'm throwing up. And that medicine causes nausea. And most people, they get tolerance, whatever, but they're so severe nausea. Sometimes I have found that it's because they have ulcers, they have, they have reflux. We're talking about that. We have other issues, and that's what's causing, the problem, and not so much the one medicine is just exacerbating underlying problems. And the other thing, constipation. Bowel regimen and sleep regimen. Bowel regimen, it is crucial to being able to tolerate medicines and have a consistent response with medication.
Last question on career, related to career and work. Any tips when it comes to deciding what line of work to go into with the limitations that come with PD, specifically for people that perhaps were working in a specific field, had to quit their job, or maybe lost their job for whatever reason, and are now at a place where they can now go back to work? Just trying to navigate everything from when you're on versus, responsibilities at home, being that this is a YOPD group, children, spouses, all of that. Any tips to navigating that and trying to decide, where do I go with my career?
Again, it's a very individualized decision, but sorry, we got disconnected here. But I think one, we have to remember that we have more multitasking difficulty with Parkinson's. It requires a lot more dopamine. It doesn't mean it can't be done. It means it requires a lot higher doses of dopamine. For me to be able to do my job, I needed like 2-3 times the normal dose that I was prescribed to be able, because I was always multitasking. If I wasn't doing that, I didn't need that higher amount. So it depends on what you're doing, what your role is. Is it something that you can do one thing and focus on one thing at a time? Then you don't have to change careers or change goals if you have the time, if you have the ability to focus on one thing. If you're having to multitask, having to do 2 or 3 things at once, then it requires a lot more, first, do we need higher doses of medicine, which will help? But then how much are you, side effects versus, amount of medications times a day? How is that going to work? Are you the sole provider? Are you, does the family depend on you? So, sometimes we can't just say, yo, stop working or continue working. You have to, again, talk to your spouse or your partner, or, are you the only person? So then, do I have a choice? Do I have to continue working? And I think this is something that I've talked many times, that sometimes I think we need vocational rehab for Parkinson's patients, like we do for other stroke patients and so on, because we have lots of skills and we're able to do lots of things. And I've been able to learn new things, but it's, again, the ability to do it on your time without the stress that's going to put, wear you off first, faster. Or are the tremors inhibiting you? Are you having dyskinesias? Are you depressed? So those are things that need to be addressed with medical treatments with your doctor, to be able to control you and regulate you and be the best you can before you decide, no, I cannot handle this job. No, even with all the best treatment, I'm still having trouble. I've had patients that one was a pilot. Of course, if you have any kind of pilots cannot take any medications. There's strict regulations of what they can do, how they can do it. So he had to, stop working. And then, he missed it so much. And this is one patient, he had DBS and he's back to flying and doing everything. So, again, it's depending on what your capabilities are, where you are in life, and also the support that you have within your organization and your job. Because some companies are willing to work with you, are willing to say, hey, maybe less hours, maybe, you can only do this. But then there's some that say, well, sorry, you have this and we don't have time, we don't have patience, we don't have any other retraining, you can't be taking less time, you can't take downtime, you can't go take a half an hour, to go decompress and get your medicines on. And so really it depends on the situation that you're on or you're in. Do you have somebody that can support you? I was lucky I have a husband, but even then, it was funny when I first stopped, decided I wasn't going to work. I was used to always having my own job, my own money, my own, and all of a sudden it's like, oh, I have to ask my husband. We have a buddy, we have, it's like, what do you do? So it's a relearning until I worked again and things. So it's something that and of course, you have a plan as a family of what your finances are, and now you have to change. So again, the social worker getting that financial advice is really important. Are you going to apply for disability? And are you going to be limited with that? Is that going to cover you? And know that most people, 90% of the time, when you first apply for disability, you will get denied. So just to know that you have to redo it, and know that maybe you need a lawyer. And so those are the issues that I think that need to be discussed. Talk to wherever you work. What are the policies? Can you take some time off, family leave, to get your medicines adjusted, to be able to figure out if you're able to function? I was not able to drive for a year. I needed people to drive me around. So, those are big, hurdles to overcome. And it's not easy, and it doesn't happen overnight. I think that what works best is doing, again, slow and low and slow, maybe cutting back some hours, maybe taking a little time off, talking to, getting the resources, what resources are available, what support is available. Can I do something else within this field, or am I going to have to change completely? Am I able to do that? Can I support myself if I am able to do this other job? So those are big, big questions that only, your family circle can help you decide. Your doctor can help you decide, getting your medicines as well adjusted as possible. And then having a social worker, support group, financial advisor. What are my options?
Lots of great things to think about. And I'm glad you touched on some of those things, because there is a organization by the name of Jewish Family Services, and they're not just in Dallas-Fort Worth. They actually have branches all across the country, and they offer career coaching as well as financial advice, financial advisory, I guess would be the correct term.
Mhm.
And so if that's something that you guys are interested in, please let me know and I can get you connected with them. Again, they're in multiple states all across the country. I've connected with the local branch here in Dallas, but I'm sure it'll be fairly easy to get you connected wherever it is that you're tuning in from. So financial and career advice is something that they do, as well as setting you up with a social worker. And I think they provide legal advice as well. So
Yeah, I think that's invariable. I think that everybody should have that, whether or not they have a chronic illness, because, I think that being prepared
yeah,
gives you some ease of mind and helps you deal with challenges as they come better. Of course, there's always things that are going to happen unexpected, but if you at least have a foundation where you know what I'm going to do if such and such happens, or what are my choices, I think that eases some of that fear and that uncertainty, and makes you feel like you're in control.
absolutely. Maria, are you still practicing?
I'm not practicing right now. I do a lot of consulting, but I finally gave up my practice because I have a lot of medical issues besides Parkinson's. So it was very, very hard to do that. But I do mostly, I do a lot of speaking. And
Mhm.
so I traveled before the pandemic, did a lot of, did a lot of traveling, speaking, and work with the nursing school and with the School of Social Work in teaching social workers how to recognize this and trying to prepare people to recognize this issue. So I have a lot of experience with that.
Wonderful. Well, I could talk to you forever, but I just have one last closing question. What is one thing that you think, one gift that you think Parkinson's has given you, or one thing that you're thankful for that you have now as a result of your diagnosis that you didn't have before?
Well, people always ask me this, and of course, I don't want anybody to have Parkinson's, but in a way, Parkinson's been the best thing that's ever happened to me, because I get to do what I love, Parkinson's. I get to meet wonderful people like yourself and all the people here. I get to travel, which I love. And I think the best gift that I got was I got to spend a lot more time with my children that I would not have otherwise, because I had such a busy practice, and I was always on the run, and working till midnight, and being on call. And so when I started decreasing my hours because of my Parkinson's, and finally when I stopped, I got to spend a lot more quality time with my children and be there for their activities. And I think that that's one thing that I don't regret, and I'm glad I got the chance to do that. And I would not have been able to do it if I didn't have an illness. I would have had to, I would have just continued doing what I did before. And so
Right.
I'm very grateful. And grateful is funny because I used to be a very shy person, believe it or not. And now you can't make me stop talking. So I think that's one of the gifts.
Wow, look at that. That is wonderful. Dr. Maria De Leon, thank you so much. This was an absolute pleasure. Thank you so much for spending time with us.
Thank
I
you.
thoroughly enjoyed our conversation. I know our attendees enjoyed, and you guys have been amazing. All of you guys, I'm so thankful for each and every single one of you that's on the call. I want you to know that you are important. Your needs are important. The needs of the YOPD community is so important, especially to us here at Skypass. We are working on some initiatives for 2022. So the more of these conversations that we can have, the better. And I want to say, Skypass aside, it's important to me personally. I want to connect with you guys. I want to hear from you. And I love all the conversations that we've been having so far. So stay connected with me. If you have any questions, comments, struggles that you're dealing with, any insights that you want to share, or if you just want to chat, feel free to reach out to me anytime. info@skypassfoundation.org is the best email to reach me. And one last thing, we are doing a YOPD research project. And the goal of this project, or one of the goals of this project, I should say, is to better understand the needs and the challenges, the unique needs of the YOPD community. And with the findings of our research, we want to actually implement some solutions and some programs to meet those specific needs. I would love for everyone that's on this chat to take part in that survey. So if you want to head over to skypassfoundation.org, you'll see a description of the project that we're working on. And at the bottom, you'll see a contact form where you can put just your name and your contact information. The first part of this project is a survey that we're going to be sending out. And we need to administer the survey to better understand what it is you guys are going through and what your priorities are, what your challenges are, what your struggles are. So I would love for you guys to take part in this. The more feedback that we can get, the better. So go ahead and head over to skypassfoundation.org, fill out that form, and that way when the survey is ready, I can be sure to get that to you. And if you know anyone that's interested, please pass that information along. So thank you again, Maria.
Thank you. Can I say a couple of things? Thank you so much
Absolutely.
for everybody. You guys were lovely. I really like all the comments that everybody was so engaged. And if you want to reach me, you can always, reach me. There's 2 blogs that I have, although I haven't written much lately just because I'm so busy with all kinds of other things with my family, but defeatparkinsons.com and parkinsonsdiva.org that you can look at. I talk about a lot of these issues that may be relevant to you. And also the Parkinson's Diva book, if anybody wants to, it's about, young onset PD, especially for women. You can get on Amazon. And it may, talk more in detail about the marriage and raising children and things. So if you have some of those questions that we really didn't get to go in detail, you can get more information through that book. And somebody just said something about DVS not being an option when they have cognitive problems. Again, we're talking about trying to prevent that, and there's medications to help with the Alzheimer's medicines and Nuplacid and Exelon and Aricept can help deal with that, along with adjusting the medication. So although DVS may not be an option at this point, we're having other things in the works that may be coming out that may be able to help. So thank you so very much.
You're so welcome. Thank you. And I'll be sending out the links that you mentioned along with some links to your book with the recording of this webinar. So if you're on here, I have your information since you registered. So you will get those links if you weren't able to make a note of it. And then I know some of you individually messaged me about wanting additional information on some of the resources that we talked about. So I've made a note of that. And you will be hearing from me within the next day or so. With that, thank you everybody for staying with us. I know we went way over time.
I know, I apologize.
No, it's okay. This was great. Thank you for staying with us. Take care, everyone. Bye-bye.